Welcome. I'm Laura Siminoff. I'm the Dean of the College of Public Health at Temple University. Our experts from the faculty at the Temple University College of Public Health, Graciela, Jaschek, Sarah Bass, Krys Johnson, and Heather Murphy, will be discussing some of the pressing issues about the COVID-19 pandemic. Today, we'll be discussing how and when we might relax some of the measures we've taken to mitigate the pandemic. So, as I know everybody knows, many people around the country are now going into the second month or more of extreme social distancing, and that entails staying at home except for things like grocery shopping or picking up medication. Most of us, when we walk outside, we've been told we need to wear masks, keep 6 feet from others. However, there's now discussion about opening up the country. So today we're going to discuss when and how this might happen. So first, let's consider this question. Krys, is the curve actually flattening?
So based off of the data that we have, it does look like the curve is flattening. And that's what we've been shooting for this whole time. But just flattening the curve doesn't mean that we can all kind of come out. Flattening the curve means that we're doing a good job with social distancing, and it's actually decreasing the number of people who are becoming infected and therefore hospitalized. So just because the curve has flattened doesn't mean it's time to run out the door just yet.
Okay. So what would be the indicators that would tell us time to come out from this extreme isolation?
So if we're still thinking about the curve, we would be on that kind of downward slope of the curve. So that would be whenever we see 14 days of decreased cases, of decreased hospitalization, and that comes with the caveat that we should actually be scaling up testing. So increasing testing, but seeing a decrease in the total number of cases. But also, in addition to that, we need to have enough PPE to protect our healthcare workers, especially since we know that if we open everything up again, we'll likely see some more cases. We also need to make sure that we have sanitizers and disinfectants and all of those things that we need to protect ourselves if and when we do venture out.
So for those of us who are living in Philadelphia, I think we'd be interested to hear what you think about where we are in this process. Where are we in the curve?
I think we are at the beginning of the plateau of the curve. So we're starting to see things level out now, and it's very promising, but we still need to maintain our social distancing for now until we can get on that downward slope. And like I said, we still need a lot of testing to be put into place before we can even figure out whether we're on that downward slope.
Okay. So Graciela, I assume that if we start to relax restrictions, that we'd have to monitor the presence of the disease very carefully. So how would we do that?
Yes, absolutely. We have to monitor who's getting infected. So as Krys said, we've been very successful with social distancing at slowing down how many people get infected every day or die every day. But the flattening of the curve, as Krys said, doesn't mean the end of the outbreak. All it means is that there are less people getting infected on a daily basis. So what we need, the best way to identify people as restrictions get relaxed, the best way we have to essentially continue monitoring people is to identify people who are currently infected and test them before they return to work or having any social contact. And if a person is infected, then that person should be quarantined for at least 14 days. Also, contacts need to be traced, meaning that any person who came in contact with that infected person needs to be notified and also has to be placed in quarantine. So before we relax restrictions, we need to make sure that we have the capacity to test everybody before returning to work and that we have enough personnel to do the contact tracing. But regardless of our capacity to test and having protective personal protective equipment, it is of utmost importance that we continue practicing social distancing, staying at least 6 feet away from people, wearing masks in public, not touching our faces, and frequently washing our hands with soap and water, or frequently using hand sanitizers.
Okay. So Graciela mentioned, Heather, that we have to test, but we all know tests are in short supply. Do you think this is going to change at all? What do you think?
At this time, I don't think that's going to change, unfortunately. I think there's huge backlogs in the supply chains for the materials actually needed to conduct the tests in the lab. So the swabs themselves, but also the lab materials. And so I don't think testing is going to ramp up for a while. I would think that it should if we're going to open up, and that should be one of the priorities, but I haven't heard that it is one of the priorities in terms of opening it up. There's been some talk of increased testing required, some articles from the New York Times, but I haven't seen any politicians really pushing it. So I'm not sure if it will change, and it could be the supply chain issues for now.
Right. So are there any other ways that we could monitor this disease?
So we can monitor through the antibody tests if people have had it. And I know there's been a lot of talk, but I think those are also unreliable at this stage. There's been some mixed reviews on the results of those antibody tests. And so I think more studies need to be done before we can really tell how useful those will be. Another kind of newer way, let's say, that they're going to monitor for coronavirus in a lot of places is monitoring sewage. So for people who don't know, you can actually, you shed coronavirus in your stool, and infected individuals can shed it for up to 20 days in some recent articles. And so researchers, actually like myself, are trying to get sewage from all around the world to use as a tracking tool. And so what was actually done in the Netherlands is they detected coronavirus in one city 5 days before it was ever reported in their first case. So it could potentially be used as an early warning system. Wow. So there are a lot of wastewater utilities and public health departments across the US and globally looking into doing this. But right now, because of the supply chain issues for testing, a lot of people are just collecting the sewage and freezing it until we kind of get the supplies needed so we can actually test for the virus.
Well, that's really interesting. So say we do start easing up on restrictions. Is this going to be all at once, little by little? What would our daily lives actually look like?
I think it's got to be little by little so we don't have a surge in cases. And I think social distancing is going to become the norm. It's something that we're all going to have to get used to until there's a vaccine. So that means the grocery store, there's going to be a line outside. You're going to be wearing masks. You'll probably wear masks to the office, to like everywhere you need to go. They'll probably have people phased in the office. So some people will telework. So there's social distancing between desks, in classes maybe. So I don't think we're going to be kind of running and opening up. And I think people should get used to kind of daily hand washing and masks, and that this is going to be a fixture for daily life for quite some time.
Wow. So I think, Sarah, that brings us to the issue that there are a lot of very frustrated people in the country. There are people who either don't quite believe this is happening, or they live in areas of the country where they haven't seen their town, their region hit that hard from it. And then we've seen some of these protests. And I'm wondering, whether or not any of this is justified, whether or not we should be communicating differently with people. What can we do for, obviously, these individuals who are frustrated and they don't seem to understand why this is all happening?
Yeah, I think, a lot of it has to do just with the concept of risk perception, and people have it heightened and feel kind of more at risk, or have it attenuated and feel less risk. And there are a lot of things that kind of impact risk perception, especially in a crisis like this. In most cases, and for most people in the US, risk perception has been heightened, and it makes us want to be more to comply with the restrictions. So, being very aware of the event because of all of the news, trust of information sources that might actually not be very trustworthy, or not trusting the process. In those cases, most people may be more likely to comply to what's going on because their risk perception is higher. And they kind of contribute to having this higher risk perception. In a small number of cases, though, and what I think is happening in the case of people that we are seeing protesting, is that they're actually feeling the opposite. So in most of these cases, they don't have personal experience. As you said, they may live in areas that don't have high number of cases yet. Their loved ones or themselves, they haven't had it. And for a lot of these people, they actually may get most of their information from very specific sources who they do trust, and who are telling them that restrictions are bad and not needed, and probably most importantly, they're trusting of the process because their sources of information are telling them that the reported problems really don't exist or are being made up by the mainstream media or political players or whoever. And because of that, they actually have lower risk perception. So they don't believe they're at risk, then they shouldn't be restricted. So, in my opinion, this is kind of an expected outcome in these kinds of events because of the mixed messaging that's occurred since the beginning. And just because of how many sources of information there are that cater to really all different points of view. So if you're inclined to believe one way or another, it doesn't take long for you to find other people who are saying that, and this kind of creates that confirmation bias. It makes it very hard to change, and because the messaging has been so mixed from the very beginning, it's kind of hard to get onto the same page.
Right. So I think that brings us back around to talking about this illness and how severe this illness can be. So Graciela, could you sort of walk us through again the sort of range of experiences that people with this illness seem to have with it, and maybe comment a little bit about why are some cases of COVID-19 very mild, if not asymptomatic, and others lead to death?
Yeah. So we know that certain people, the old and those who have underlying conditions such as diabetes or asthma, they are at higher risk of having bad outcomes and ending up in the ICU, on ventilators, or even death. But in most people, the infection is mild, and people may not even notice that they are infected. So they go about their usual business, except that they are spreading the virus. When we get infected, the virus enters into our throats. If we go by someone who coughs or sneezes or talks, we inhale that virus, and it gets into our throats and into our lungs. In mild cases, what happens, the virus attaches itself and enters the throat cells where it starts multiplying. And antibodies, the body, your own immune system, produces antibodies, and that is to target those infected cells, kills those infected cells, and then the person recovers in a couple of weeks. Occasionally, however, the virus can cause severe outcomes. And that is because the virus, instead of staying in the throat, infecting the throat cells, will travel down to the lungs. And when the infected lung cells get destroyed, the lungs become congested. And so our immune system sends these antibodies that recognize the infected cells, kills them, then our lungs become congested. And those are the people who end up maybe in intensive care or even ventilators to help them breathe. However, in a few cases, the immune system goes into overdrive and they cause inflammation, which in turn causes the immune system to overreact and produce even more inflammation. And that triggers what's called acute respiratory distress syndrome. And this syndrome is really life-threatening. It's a life-threatening condition in which the lungs, in fact, drown from all the fluid leaks from these cells being destroyed and the inflammation. And so at that point, breathing becomes impossible and you may die at this point. And that's what we call the cytokine storm. And in some cases, this incredible overreaction and overdrive of our immune system will kill the patient. And this can happen at any age.
So I think that's it for today. I think just to recap, I think what we're hearing is that we are just at the point where we're plateauing, that all the things that we've been doing so far are working, but we can't really relax. We still have to continue to stay home, wear a mask, wash our hands, stay 6 feet away from anyone. So if we just sort of hang in there for a while, we can at least be released from extreme isolation. But even going forward, we're still going to have to take a lot of precautions. So I want to thank the panel. To hear last week's panel, a few other videos and links to reliable information, just visit our website at cph.temple.edu/coronavirus. Thanks.